few minutes after 1:30, December 19th, 2024. This is the Opioid Settlement Lewis and Clark County Metro Region Governance Committee. And we have all members of the committee here. And we want to discuss first the St. Peter's Health Foundation request. Let's just open that up for discussion. Anybody have something that they'd like to throw in?
I looked over the additional materials that were submitted that spoke to the like the program outcomes, and I thought I liked them. What I saw, I liked. I was also wondering, I was thinking about this, and I don't know if we're past this at this point, but I know last time we met, we were talking about, I don't know if it was decided or if we requested that they reduce their proposal to one vehicle versus two. And I was just thinking about, I mean, I don't know if Amy can speak or Nova can speak to a little more about that, because I don't feel like two was just kind of pulled out of the air. And while they readily agreed they could probably make do with one, I don't want to artificially hobble this program from the start. I mean, and to me, $35,000, it's, less than 10% of what we have this year. And this is something that could be beneficial for years to come. So I don't know if we could just revisit kind of that, how we asked them to, and I'm not even sure if we asked them to reduce it or we did reduce it, but I know it came up as a topic at some point.
Anybody else have a thought on that?
I think one of the pieces is depending upon what is approved, it may be less.
Wes, I'm sorry, I'm not hearing you very well.
How about now, Commissioner?
Yeah.
Sorry about that. Thanks for letting me know. One of the things is if we were to reduce the amount or not, what would, and I apologize to Ann and Amanda, but maybe if you could update us again on the amount that we have remaining, and then we could take that into consideration just for the future.
Thank you. I can find that number. It is so currently for this fiscal year there is $484,968.31.
Say it one more time, Amanda. Sorry. 484.
484,968.31.
Thank you.
After the original one that we did for the trip.
Correct. That's correct.
And I'm happy to speak to any questions. I know since we had chatted last time, Kayla was able to pull some additional numbers, and in the last 6 months, we've had 533 trips. So essentially taking someone somewhere, picking someone up for 153 patients. So obviously, patients may need to use it more often than some others, and over 5,000 miles that we've driven. I think the most challenging thing for all of this is that you can never really predict when a crisis is going to happen. And if someone is, taking an individual to an appointment or checking in on them, if a crisis situation happens, and then we've got a provider that says, yeah, I can make them work them into our schedule today. Can you get them over here? We either have to send them out by foot. Or sometimes you can use the buses, but with the Helena transportation at this point in time, you have to schedule rides 24 hours in advance. So that's been a little bit of a challenge and barrier for us. But But I think that that's just kind of where, when we talk about two, is that you, especially if we have two individuals, we can never really predict when there's going to be a crisis or a moment where we need to have that vehicle being, in two different, a vehicle being in two different places. And then what we found is when we have one, for whatever reason, it sits because you kind of are in your mind thinking, well, this one may, I may need to wait because there might be a bigger crisis or situation that we have to address. And then sometimes it doesn't get used. So it's kind of an interesting situation, but
Thanks, Amy.
How does everybody feel about the additional information that came from St. Peter?
I appreciated the information and putting that into SMART goals. I also thought that it was, well, we got kind of the information that we were looking for, so I appreciate that as well. And just the way that it was presented to us. So I felt more comfortable with it. If we were to approve even at the full amount of the 250, we would still have, what was it? 160,000 left for the rest of the fiscal year. Again, one of the concerns that I do have is just awarding all of it, because next year we will have less. So I don't know that awarding all of it is the best idea this year, so that we can keep these at least somewhat consistent. I know that St. Peter's, for example, won't be needing as much next year if they were to request it, but just for the sake of conversation. So I'm fine either way. I appreciate actually just having the conversation of one or two vehicles, just to see what that looks like. And some good points. The one question I did have left was Amanda and Anne, was the depreciation of vehicles, of assets, of lease. Did we get any information on that? Because I did not find that in any of the email responses from you, and maybe I missed it.
Councilmember Feist, the response we got from the moat on that was more or less, as long as the expense falls in line with Exhibit E of the agreement, that then it's an allowable cost.
Okay.
I don't think at this point, and I would venture a guess, and correct me if I'm wrong, but I mean, I don't get the sense from them that they're interested, because they receive payment on the front end. And these are private dollars. It's not federal or state funding, public dollars. There's a particular scenario in which we have to manage that asset in a certain way, in terms of either getting rid of the vehicle later on, depreciation, maintenance, etc. I just don't think there's a mechanism in place for managing that.
Okay,
And
so if it was a donation essentially, or a part of the purchase to the foundation, then that would just be the foundation's own vehicle that happened to be purchased by the moat for the future.
if it was, yeah, I think the idea is that it would be used for the purposes that are outlined in the opioid abatement settlement agreement.
Okay. Thanks.
That's probably vague, but that's
It's an
all we
answer.
got from them.
Yeah, no, it's an answer, and is a much easier answer too. They say it's allowable, and we kind of seemed to tentatively agree that it was an allowable expense. We weren't questioning that by any means. So you answered the question. Thank you.
I still have a problem with two cars. Not only because of the expense, and I mean, we just got another proposal in from Good Samaritan that addresses peer support and some other things. If we did one this year and then they found out that there was, a huge need, I mean, I hate to buy two cars for, oh, well, we hope that we have it just in case. I mean, it obviously would be nice to have, but I feel like maybe this first year, like Wes mentioned, that maybe we shouldn't be blowing everything first. And if they find that one is not enough, they can always come back possibly next year and request another one. That's just my thought. And the other thing is, if we go ahead and do this, could we get some kind of wrap or something on that car that identifies that it was purchased by the MOAT or the Lewis and Clark Abatement Task Force, or somehow to get some recognition?
I'm totally good with that. I think that's a great idea.
I love that idea and co-branding that. I don't think that they're too expensive to get those vehicle wraps.
Yeah, I think part of it would just be like the design, if there's like a logo or how we'd want that. But we just recently wrapped 2 cars for our community health workers, and yeah, it's not super expensive to get them wrapped.
Do you know off the top of your head what that looked like?
Like the
Expense.
cost?
Uh-huh.
I don't off the top of my head. Nova, do you by chance know?
I do not have that off the top of my head, but I can easily get it because the foundation has those numbers.
Any other comment on the St. Peter's request? Are we to the point where somebody would like to make a motion?
I'd be happy to move to approve the St. Peter's Health. I'll bet the one vehicle, so the reduction of $35,000. And I appreciate Colleen's thoughts of maybe come back next year so that we can try and conserve some of the funding. So I make a motion to approve the funding for in the amount of, well, I can get the exact amount if you want for the motion here. Sorry, unless somebody else wants.
$215,051.
So I move to approve the St. Peter's Health Foundation for $215,051.
I second.
Right? Is there further discussion?
I like Kathleen, your idea about just hitting pause on the one and let's see what the need actually is and see how much it's used. That's a good, I appreciate that. I don't know if this is totally related to this motion, but Amanda, the 484, was that our total allocation or is that what's remaining less what we gave the sheriff's department?
That's what's remaining less what we gave to the sheriff's department.
So taking this out actually leaves $250,000 approximately. Because if we're starting with 484,
I was taking into consideration, James, if we were to fund the SIM-MT program also. That was just, not that we are, but that was just in case we did that. Sorry if it wasn't clear on that. Thanks for clarifying.
no, thank you. All right, that's all I had.
It would appear to me that we're at 269,968.31 if we well 17.41. Is there any further discussion? No further discussion. Is there any public comment? Is there any public comment?
Mr. Chair, there's no public comment online and nothing in the chat box.
Then we'll move to a vote. The motion is to Done the St. Peter's request, which is St. Peter's Foundation request. In the amount of, 215,051, which would represent just one year on full food. And, from the regional request.
Mr. Chair, if I might,
Yeah,
may we take a roll call vote just because it's a little bit challenging when everybody's talking at once online? I would appreciate
bet.
that.
you bet, we'll do that.
Thank you.
Let's, James, do you, we'll do a vote, James,
I vote yes.
Pauline,
Yes.
Wes,
Yes.
and I vote yes. So we have 4 yeses, no nos, and the mayor is absent. I forgot to mention that when we started. All right. Motion carried. Let's go on then to the other item on our list, which is the request from the group, stimulation training and opioid response plan improvements. Storpy.
Mr.
Is
Chair.
there any- Yes, Amanda? What?
Apologize for interrupting. I just wanted to interject in case the folks from St. Pete's need to take off. Then the next step in the process is that a formal recommendation will be written on behalf of this committee, and that will go to the Montana Opioid Abatement Trust, which is the state group that reviews and approves or denies funding. So just to clarify, the funding has not passed today. There's another step in the process. And I believe that they are meeting, and correct me if I'm wrong, the first or second week in January to review recommendations that would come from this committee. So I just wanted to clarify that from a procedure standpoint.
I believe that the vote advisory meeting got moved to later in the month. I think it's January 27th now.
January, what?
I believe it's January 27th. We just got an email regarding that today.
Okay. So we're gonna meet on the 27th of January. And it'll probably be a week or two after that, we get the formal, information. All right.
And if they're looking for additional information, everything would, I presume, will be up to date. If for whatever reason things get moved out again, that information is on montanaopioid.org.
Okay.
And
All right.
Ian,
Any folks from St. Peter's have any questions at this point?
I do not. Nova, do you have any questions?
I do not either. Just thank you for approving the application and for the award you listed. And we are really excited about getting going on this work. So thank you for your time. We look forward to the next step.
And we're kind of feeling our way through this, right? And this is the second request we made from the fund. We make the recommendation, and then it has to be formally approved by the statewide trust. But I don't see from what we know of any complications there. If there's any hesitations or problems, we'll get back to it.
That sounds great. Thank you.
Okay, anything else that we should add? All right, well, let's go on and talk about the Storky group. Does anyone have a comment at this point? Any thoughts about it?
I did reach out to the references provided, and I did hear back from Deborah Rappaport at Helena College. She left me a really detailed, lengthy voicemail about their program that they used them. They did some training for students. and could not say enough positive things about them and the training, their attention to detail, the professionalism of the staff that provided the training. So there was a very high recommendation about the program from Helena College's nursing director. So I thought that was positive. I did reach out to the others just this week, and I didn't hear back, which is fine, but did at least get one. So wanted to share that as well.
One of the things that occurred to me, if I might just throw it in out, we talked about it. It sounded like they are sending out requests for virtually everybody, like this. And I wondered if this was maybe in reality a request that was more appropriate from the statewide or organization. I know they were told that because they kind of standard routine to move forward, that they would need to approach the different local and regional groups. And I'm wondering if maybe we have to talk to that, wait a little bit to see where we're going here, and if it's more appropriate, we'll send this to a regional group or a statewide group that might make it easier. Any thoughts?
I guess my concern with that is nothing is moving statewide because not everybody's set up. And I like that they're going to address our county, whereas if it's, regional and they only have a limited number of money, that those smaller communities might get pushed out.
Okay.
I appreciate the thought behind that too, Commissioner, because I had hoped that they would be up and running. I think I was feeling similar to where you are until their rationale that they will still do region by region if it works out. So I think that regardless of how we approve it, if we waited or not, they're hoping to still go across the state. They would just be doing it in maybe a different fashion, maybe able to adjust their application and later on. What I would say is for now, we may get the greater attention now and the earlier attention now if we were to approve it for this county versus if it was on a statewide basis. I don't know where we would fall within that action plan. So my hope is that if we were to approve it today, if everyone felt that way, that they'd be able to get started in Lewis and Clark County sooner than they would on a greater statewide level.
Mm-hmm. Okay.
These are great points. I think for me, I was just trying to kind of, and maybe this is where representatives from the organization could shed a little more light. From my reading, it's a one-day training is what's being proposed at 3 different sites. 2 sites would get 2 trainings, 1 site would get 1. And I'm just trying to get a sense of what it looks like. I mean, how many people show up? What equipment are they bringing if they're doing simulations? $15,000 a training feels like a lot of money. And so I'm just trying to get a sense of what resources are like coming to bear on these things. I mean, it's just, I don't know that I know enough to say what's efficient or appropriate in terms of, cost. I didn't read it. So I didn't read that defined in the proposal as much. And I was just wondering if someone could share a little more about that. Maybe Sarah.
There we go.
Would Sarah like to respond to that?
I would love to. Sorry, I was just figuring out how to unmute myself. Thanks, thanks everybody for inviting us to be here. We really do appreciate you considering this project. James, in answer to your question, it's a really great question, one we get asked often. So the main day that you're referencing is broken up into 2 pieces. And the beginning piece is really for the medical teams to kind of practice a just general skills check on opioid response. How do we respond to this, not only just to the patient themselves, but then what are our protocols for what gets triggered outside of just the patient care? But the real power of the day is what happens in the afternoon or the second half of the day, which is what we consider what we call a tabletop session. And our hope is that we get all of the major players, and this is something we do with a lot of different topics, but have never been able to apply to opioids yet. But how do we get all the regional people at the same table to talk about something beyond just maybe delivering Narcan or responding to an opioid overdose? How do we actually make a regional response when there is a spike in opioid traffic in an area? And so that looks like a lot of players, especially in an area like yours, where you might have everyone from the public health departments and the hospitals and the EMS and law enforcement and county commissioners, maybe even, or press, anybody who might be involved in actually what happens after an opioid overdose, and so that the whole region can respond appropriately, especially if there's a rash of overdoses specific to one particular batch that's coming through the area. How do we make sure that we're kind of responding on a larger scale and getting in front of it as much as possible? So there are in your area probably a good number of people who are going to be at the training. And while the simulation training may be kind of a smaller group of the medical providers participating, everybody else we hope will be kind of or watching as participants to see what does it actually look like to respond to an overdose, or participating if that's in their field. But then really working together to kind of come up with what is the after action plan of what we're going to do as a region when there's spikes in opioid traffic. And then beyond that day, because you come up with a plan always at these tabletops, but then it really is about returning the second visit. That's why there's a second visit, to both give other people a chance to participate, but also to put that plan into action and figure out where were the holes. Is it working as well as we think it's supposed to work? Are we still missing pieces or protocols that need to be updated? Along with participation in kind of our ongoing online stuff that's going to be happening for the year. And to your point, as other regions come on board and we start inviting more and more people and doing this across the state, the hope is that they could start sharing resources and sharing ideas and bringing in experts to address needs that they're actually seeing. So it is a one-day training in its simplest form, but it's really the power is in what you're building, the support that you're getting, the access to experts as things come up in your community that you're like, what should we do about this? And just the networking across the state of who's finding success with different strategies.
Thank you, Sarah. That was very helpful. Just a quick follow-up. Sounds like, so the two visits to like Benefice and St. Peter's as proposed are connected. They're not two different. Well, it's not the same training being done twice, is what I heard.
That's correct. It's usually some sort of escalated scenario because that's what's really going to test the plan, and so like maybe it's a few people at the same time, or, the simulation, the actual scenario that they're practicing on will escalate, but also it's really a way to revisit what they put in place, make sure it's working, or do tweaks still need to be made? So it's connected, but not really connected, and usually happens about 6 months later, something like that.
Okay. And just, I don't mean to, how many folks facilitate the trainings? Like show up?
From our team, you mean?
Yeah.
Yeah, it can be anywhere between, usually it's a team of 2 who's actually putting on the day. An event this size, depending on how, in a metro area like yours, it could be up to 4 would be there.
Awesome. Great. Thank you. Oh, wait, one question. And your organization offers a lot of different kinds of simulations. Would any of those be woven into these days, or are you proposing trainings that are strictly focused on like opioid response?
Yeah, really great question. Oftentimes what we'll do, James, is like, because the actual like administration of Narcan at this point, a lot of people already kind of understand how to do it. So what we love to do is try to figure out, what things would they love training in. So it could be, for example, an overdose that's leading to a hanging or something more traumatic, something like that. So a lot of times we work with the facilities to figure out what things are you seeing in your area that you might also like to practice or a response to, and see if we can't blend them together, working in, you know, the opioid piece, of course, to make sure that we're actually building the plan that the area needs.
Great. Thank you very much. I appreciate your responses.
You bet.
Other questions for Sarah?
Commissioner, this is Wes Feist. I have one. And appreciate your question, James, and your information, Sarah, as well. Would the committee here be able to provide input as to who is invited to this training as well, or see the list once you have it compiled to then offer any other suggestions? Coming from a small community and representing a small city, I know a lot of folks are often left off of some of those bigger lists, and so I just want to make sure that if this was approved, that that we have some input as to who all is invited to make sure that as many as possible are able to participate.
Yeah, absolutely. We would actually prefer that and appreciate that. And not only who you might like to have at the table, but even extending invitations. Sometimes we get more people at the table when they're being told about a project from somebody they know and trust. And we have a lot of contacts, but that doesn't mean we know everybody. So absolutely, we would welcome that.
Terrific, thank you.
Um, and I'm sorry, Sarah, one other question. How do you evaluate these trainings? Do you evaluate like the participant experiences, and how maybe do you track some of these broader outcomes that you were discussing earlier, like more coordinated response? I mean, just what's your approach to that?
Yeah, don't be sorry. I love these questions. These are great. It's important. So yeah, the actual day itself, it requires, but we always start with a pre-survey and a post-survey just to get kind of the experience of, hey, how did you feel about your ability to respond to this type of call before you even start it, followed by the end of the training, how are you feeling about things? The after action plan itself that comes out of that is why I think it's essential to come back the second time, because that's really where we're going to be able to hear from the participants that, hey, this plan that they created, knowing their communities, it's either working or it's not working. And how do we help you kind of find your way through that? So there'll be quite a bit of discussion and data related to that piece as well. As well as, a couple of our partners in this particular project have some tools that they're going to be willing to share that'll be available to the participants for free that I think are going to help with some of this stuff. And so any data that are collected through those tools, should people elect to use them, is also going to be kind of rolled into our data collection and analysis of the project. So there's quite a few kind of different approaches for data collection and assessment of impact.
Awesome. Thank you.
Yeah.
Question that I might have for you, Sarah, and we really appreciate you coming, being on here to be around people. I think that maybe if we are in fact one of the first to see what it will be what I think we're doing. And for us to kind of have a feel for it, I think it'd be really helpful if one or two of us could attend at least a portion of the session of one of the double sessions. And in order to pass that on, maybe we can pass information on to other people around the state as well. Would that be possible?
Oh, absolutely. We would love to have you there for sure. Yeah, that would be wonderful. We don't always get people who are able to come. So to have this group there would be wonderful. Not only just to see how it goes, but also because I do believe you're probably key players in your areas. And so, to even be part of the discussion is probably going to be really worthwhile. So absolutely, we would welcome you.
Any other questions? Any other questions? Is there any public comment on this? On this report?
Mr. Chair, I'm seeing none online and none in the chat.
All are we ready for a motion?
I will make a motion, Commissioner, to approve this program pending a review of that list for providers or trained who will be trained. I will also say that I like this approach because I think that we're trying to do what the moat is intending, which is a multifaceted opportunity for training as well as some outcomes for those that may have immediate needs. So I appreciated this one and would look forward to it. So I make a motion to approve pending a review of that, or not pending, but with a review of that list as part of our requirements.
There a second?
Second,
All right, we have a motion by Councilman Vice President and second by committee member Pauline Smith. Any just further discussion? Any first discussion? There being none, the motion is to grant the $75,000 request to the planning group, Storpy, and we'll take a roll call vote. Councilman Fudge,
Yes.
Colleen Smith,
yes,
James Pepperell,
Yes.
and I'll vote yes as well. So again, we have a 4-0 vote in favor of it, of this request for $75,000. All right. Again, I believe, Sarah, you were on, here are our comments about the fact that we have to send this out into the statewide organization, and then they have to ask for this formal award. Do you have questions on that?
No, we really just appreciate the support and look forward to what Moat has to say and pretty excited about the possibility of working with you all in your area.
Well, we're looking forward to good results for the training.
Yes.
Yeah, I think we all have on that. Yeah. Anything else from the rest of the group? Let's talk a little bit about the meeting of the moat is not going to be till the end of January, and we are meeting quarterly. So I'm assuming we're talking about something like April for their next March or April for the next meeting. We'll probably want to get together after we hear any comments from them from their meeting at the end of January, and we'll want to take a look. There may be another request to come in for us to take a look at. We could start looking at that. Any thoughts then? Maybe we should try to get together sometime in late February. Would that work for the rest of you?
I think February sounds good.
Okay. All right. And I guess we lost Pauline in there. I didn't see that. Maybe that's why don't we, Amanda, if you would, when we get the response from our request to the state trust, going to send out let's try to set something up for late February. About. I
can do
think I prefer the in-person meeting, but maybe it's a simple doing it for the
You bet, Mr. Chair. We'll aim for an in-person meeting in February. I'll send out a few options. And
And we might keep in mind that I think that our charter says that we're going to re-elect officers at the beginning. I have requested from the county commission that I stay on for another year on this one. And I don't know what the rest of you. I guess, Wes, would you have are you going to stay on with this as well, or you know what?
I apologize, Commissioner. I think you were talking to me. I'm having a little bit of a hard time understanding you sometimes. But if that question was what I understood, which was if I'm going to be staying on, I think so. We didn't put a time frame on my appointment to the moat. And so I think I'm on until I'm not. And I still have a few years left in my term on the city council, so I'll still be there for a bit.
We tried in the county commission to rotate, but I thought having this didn't. But we worked on this to get started, but as we equal for me, so I then do it. That's the income. So,
I definitely understood none of that, Commissioner. I apologize. And it looks like your internet service, I can see the thing turning different colors, maybe fading.
uh-oh.
It-
Maybe I can talk a
That's
little louder.
better.
Is that better? I was just gonna say that I we'll try to get together then but I think that'll have to be a part of the first meeting that we have in the next year to establish the new chair and vice chair. Okay.
Great.
All
And Amanda and Anne's not on, but Amy has also offered to help with this. So if that's something you wanted to host in East Helen and we can have you out there and Amy can help, we would be happy to do so.
All right. Wonderful. Wonderful. Thank you. Is there anything else to come before the group? We always ask too if the public has any additional comments not related to today's agenda, but would fall under the jurisdiction of our opioid price. But is there any public comment? Is there any public comment? If not, we're adjourned.
Thank you
Merry
all.
Christmas, everybody.
Thank
Merry
you.
Christmas.
Merry Christmas to everybody. Have a great one.
You too.